Severe cases where the ulcer is complicated, you may have the vomiting of blood or the passing of blood in the stool. And in some cases, you may have the ulcer boring right through the wall of the stomach and causing very excruciating and sudden excruciating pain when the ulcer penetrates through the wall of the stomach. So these are medical emergencies when a patient vomits blood or has this penetrating ulcer.
What's the diagnosis like?
So usually if an individual has a pain that's, once in a while one indulges oneself excessively in food and so on, one could have discomfort in the stomach which abates usually after some time. But where an individual has pain that tends to recur, in cycles and goes on for weeks, for months, or even years, then it's important that the individual seeks medical attention, to find out the cause of this pain, because the pain tends to be a long-standing pain, so that's the pattern that the person should see a doctor to make a diagnosis. It's also important to see a doctor because there are many other causes of such similar pain in the abdomen. So not everybody that has pain in the upper part of the belly has an ulcer, and there's often that mistake of trying to, for inexperienced doctors to say that a patient with pain in the upper part of the abdomen has
what could that be?
Ulcer. It may not even be an ulcer, it may be cancer of the stomach. So it's important to, actually make a diagnosis. It could be gallbladder disease, it could be disease of the pancreas, it could even be disease of the liver, and so on. So there are so many organs that produce pain that is similar to, the peptic ulcer pain. So it's important to be able to differentiate that pain from these other pains and to manage the patient appropriately. The diagnosis will be based on the age of the individual. In a younger individual, say probably below the age of 30, one could go for trying to make a diagnosis by trying to find out if the person is infected with H. pylori. Since H. pylori causes most ulcers, if the symptoms are suggestive of an ulcer and one does a test for H. pylori, then if it is positive, one could assume that that young individual has peptic ulcer due to H. pylori and treats accordingly. But in a situation where the person does not respond, then further investigations will be required. But in older individuals, usually people above 40, it's usually imperative that a diagnosis is made because usually there's a risk of cancer as well as one grows older. So it's important to be able to confirm one's diagnosis, before one treats. And the best method of making a diagnosis is to pass a test called endoscopy, upper gastrointestinal endoscopy. We pass a flexible fine tube through the mouth into the stomach. The tube has a video camera at the tip, and it videos the whole length of the intestine as it goes down into the stomach. So one can actually see the stomach very clearly. If an ulcer is present, you'll see it. If there are other predisposing causes to an ulcer, like evidence of inflammation, infection, if there's suggestion of cancer, one will also see it. And one can also take tissue for more investigation, to confirm cancer, for example. So the upper GI endoscopy is the diagnostic test of choice in peptic ulcer disease.
Let's talk about the treatment. What are the options?
Usually, since the basic problem is that, for example, if the patient has H. pylori infection has interfered with the integrity of the lining of the stomach and has made it possible for acid to penetrate and cause acid and digestive enzymes to cause damage to the wall of the stomach. Neutralizing acid will help in reducing pain. Antacids will play an important part in reducing symptoms in people who have an ulcer. If it is confirmed that an individual has Helicobacter pylori infection, then one will definitely need to use antibiotics. These antibiotics are usually combined with acid-reducing drugs that reduce acid secretion from the stomach. But it's important that an individual completes the course of treatment because that's the main problem. Most people, as soon as the symptoms improve, tend to not to complete the course of treatment, and this trend has led to a big problem in the treatment of peptic ulcers, the problem of resistance to the antibiotics. Helicobacter has become very resistant to many antibiotics that are available now. And it's because people tend not to complete the course of treatment. And you have bacteria that have been exposed to these drugs but have not been completely eradicated. So they become resistant to subsequent exposure to those drugs. So it's important that every individual who is being treated for an ulcer completes, or for H. pylori, completes the course of treatment.
Talking about complete use of the medications given, does it mean that this is going to take care of the peptic ulcer forever?
No, in the past we thought ulcers, you lived with your ulcer and died with your ulcer, but we now know that you can cure an ulcer by eradicating Helicobacter pylori infection. And but it's also, like I mentioned, the individual who develops an ulcer, even from H. pylori infection, has some other predisposing features like genetic factors. So the person may also be prone to recurrence of the ulcer. So we advise such people to avoid the use of non-steroidal anti-inflammatory drugs, to avoid excessive use of alcohol, to eat regularly, and to avoid smoking. These are things that will tend to impair healing and make an ulcer recur.
Now let's talk about prevention, at least maybe for people who do not have this infection yet.
Good hygiene is also very important, that one doesn't take contaminated food and water. Generally, one eating out a lot, especially in non-hygienic environments, will tend to predispose to recurrence of infection. But generally, if one eats in a healthy and in a clean and environment with adequate water, usually the ulcer should not recur. Basically, the smoking is very important. If you don't smoke, then don't start smoking, or don't expose yourself to excessive smoke, by passive smoking. Then alcohol use in moderation, regular meals. It's important to have regular meals. And then if one discovers any abdominal discomfort from the use of these drugs, non-steroidal anti-inflammatory drugs, then one should keep away from them. That's another thing I wish to mention. There's this practice that is quite prevalent, where people above 40 are advised to take a tablet of baby aspirin. That practice is being discouraged generally because it could actually lead to bleeding from the upper GI, from the upper gastrointestinal tract. Usually, these drugs must only be prescribed in specific circumstances. They're not just for general consumption, and they're not that completely safe as to be taken, on a general basis. A doctor has to indicate that, or specify that it is indicated in a particular individual.
Talking about the treatment, is there any room for self-medication?
No, it's not. It's important to see a doctor who knows the correct combination to use, and also knows the antibiotic resistance pattern in the environment.
If you still have concerns over peptic ulcers, you can reach us on any of our feedback platforms on the screen. I'll be back with stories in and around the health world. We start off the news segment on the home front, where Nigeria's health sectors seem to be in another round of industrial action, this time by the Nigerian Union of Allied Health Professionals. From 8 a.m. Friday, August 16, physiotherapists, pharmacists, dietitians, radiographers, medical scientists and other allied professionals donned tools in both the state and federal government tertiary health facilities after the expiration of a 21-day ultimatum to the federal government, which ended on July 31st, and another ultimatum which ended on August 15th. The decision of the union to go on an indefinite strike action is to press home their demands, which include the dissolution of the recently inaugurated boards of management of teaching hospitals, the immediate stop to what the union described as imposition of university lecturers on teaching hospitals as chief medical directors, and the full implementation of Abdullahi Bello's report on industrial harmony, among others. To other health matters, an appeal has been made to the federal government of Nigeria to do more in the area of polio eradication especially in tackling the insecurity